Colic, a word that every horse person knows, and yet it remains so vague, so broad, so frightening, and for some, life-changing. Colic isn't one specific disease, it's more of an umbrella term for anything that causes disruption in the horse's digestive system. And that can be many things, sometimes mild and sometimes fatal. It's a sensitive topic. Many have lost a horse to colic, and at the same time, it's a daily reality for equine clinics. In this video, we'll explore colic step by step. We'll start with the different types of colic and what causes them. We'll go over the symptoms so you can recognize them early, because in the case of colic, this is essential. We'll look at treatment options, what your vet might do, and what you can expect. And finally, we'll talk about prevention. What can we do to reduce the risk of colic by better understanding the horse's natural needs? Always seek professional veterinary advice. This video is meant to provide global information to help you understand the process, recognize symptoms, and offer basic prevention tips. However, prevention is not always possible, and if you suspect colic, please contact your vet immediately. The information provided in this video does not replace professional medical advice, such as that given by a vet. Remember, colic is a general term for anything that causes pain inside a horse's belly. That's why it can have different causes, some mild, some serious, all worth understanding. Before deep diving into each specific type of colic, let's first briefly mention them all. Spasmodic colic, gas colic, impaction colic, sand colic, strangulation obstruction, displacement. We can broadly divide colic into two main categories, namely medical and surgical colic. Medical colic, which can often be treated with fluids, medication or management changes, like spasmodic colic, gas colic, impaction colic and sand colic. And surgical colic, where the only option is surgery, like strangulation obstruction and displacement. Some cases shift from medical to surgical if not caught in time. That's why early recognition is key. Just a quick tip. As soon as you've called the vet, it's a good idea to have 2 buckets ready, one empty and one filled with fresh water. This way, if the vet needs to give paraffin oil or fluids, you're all set and you can save valuable time. Let's start with one of the most common type, gas colic. The main cause of excessive gas buildup in the intestines is usually due to fermentation of feed or sudden dietary changes. Fermentation in the context of a horse's digestive system occurs in the horse's large intestine, where microbes break down fiber and some starches and sugars into volatile fatty acids, which the horse can then absorb and utilize as energy source. This is a natural and essential part of the horse's digestive process. Horses can't digest fiber on their own. They rely on these microbes to break it down into volatile fatty acids, which provides energy. So, if it's a natural process, why can it go wrong? Well, horses aren't designed to digest large amounts of fast-releasing carbohydrates like grain, corn or sweet feeds. When they eat too much of it and too quickly due to the pellet form, the small intestine gets overwhelmed and undigested starch spills into the large intestine where it doesn't belong. Fermentation then speeds up too much, producing excess gas and acids. This disrupts the gut balance, causes bloating and pain, and can lead to colic and inflammation. So, now we know the causes of gas colic, but what are the symptoms? The horse may be watching his flank, sometimes may be kicking at the belly, pawing with its front hooves in a stretched position. The horse may roll, but usually not in a severe way, not like with obstruction, where the horse may throw itself on the ground. The belly is bloated, that causes mild to moderate discomfort. Sometimes, just letting a little fart can ease the pain for your horse. So with gas colic, the pain often comes in waves. The horse may seem uncomfortable, then appear better for a while, only to show signs of pain again. This up and down pattern is typical and caused by shifting gas pressure in the large intestine. When the vet checks the horse, they'll often hear a noisy or pinging gut sounds because of the trapped gas moving around. The heart rate might be a little bit up, but temperature is usually normal. When rectal exam is performed, things mostly feel normal or maybe a little bit swollen. The treatment usually includes giving pain relief medicine and sometimes a little sedation to help the horse relax. The horse is walked to help get the gut moving again, and feeding is limited for a while to avoid making things worse. After the vet has treated the horse, make sure to follow all medication and feeding instruction carefully. Watch closely for any changes. If the horse doesn't improve or gets worse, call the vet immediately. Gas colic itself is usually not the most dangerous type. However, if gas builds up and slows down the normal movement of the intestines, it can make it harder for the food to pass through and potentially cause a blockage. Also, sometimes what appears to be a simple gas colic may actually be caused by narrowing a partial blockage already present further along the intestines. This is why it's so important to call the vet promptly to see if there's any underlying problem rather than just gas. Now let's go over to another common colic type, spasmodic colic. Spasmodic colic is caused by sudden, abnormal contraction, spasm, of the smooth muscles in the intestinal walls. These contractions disrupt the normal movement of the digestive tract, known as peristalsis, which helps move food and gas along. The most common triggers include sudden dietary changes like new type of hay or grain, too much starch or sugar. Stress like transport, separation anxiety, and so on may lead to spasmodic colic. Dehydration can also be a trigger. If the horse isn't drinking enough, gut movement slows down and electrolyte balance gets disrupted. A simple way to check for dehydration is the skin pinch test. Gently pinch a fold of skin on the neck, lift it up, and then let it go. If the skin snaps back immediately, the horse is likely well hydrated. If it stays tended or returns slowly, that's a sign the horse might be dehydrated. Parasites, especially those affecting the small intestine. These factors can make the intestines overly reactive or irritable, mainly the small intestine, where most nutrients absorption occurs. It's especially sensitive to electrolyte or pH changes after a sudden diet shift. The large intestine, cecum and colon plays a key role in fermentation, but sudden changes in feed can disrupt the microbes living there, increasing gas production and causing cramping. The pain comes from cramping in the gut. The intestines contract too hard or unevenly, stretching the walls and sometimes trapping gas or food for a while. That's why the pain often comes in waves. The gut tries to fix the problem, settles down a bit, and then spasm again. So now we know the causes of spasmodic colic, but what are the symptoms? The symptoms of spasmodic colic often come and go. You might see your horse showing signs of belly pain, like looking at their flank or pawing at the ground. They may lie down, get up again, and repeat that a few times. Sometimes they seem a bit restless or nervous, maybe even sweating lightly. And one thing you might really notice, their gut can be making quite a bit of noise. Some horses even have loud gurgling gut sounds that you can hear without a stethoscope. When the vet examines the horse, they usually hear very active or even exaggerated gut sounds, sometimes loud and rushing, because the intestines are contracting more than normal. The heart rate can be slightly elevated, but often still within normal range. The temperature is usually normal too. During rectal exam, the vet might not feel anything too unusual. Sometimes things just feel a little bit tense or overreactive. The horse might show some light signs of discomfort during the checkup. The treatment usually involves giving medicine to relax the gut muscles and reduce pain. Sometimes mild sedation is used to help the horse calm down. If the horse is dehydrated, the vet may give fluids to help get things moving again. Walking the horse gently helps get the gut moving again. Feeding is limited for a short time to avoid making things worse. After the vet has treated the horse, follow all medication and feeding instructions carefully. Watch closely for any changes. If the horse doesn't improve or gets worse, call the vet. Spasmodic colic itself is usually not the most dangerous type. However, like any other colic, if left untreated, it may lead to more severe colic case like displacement. Soft movement like walking and monitoring can keep it on the green side.
Vervain is considered safe to plant along the borders. My horses leave it alone. The flowers and leaves are often dried and used in herbal supplements, where they are said to have calming effects. Though, always consult your vet before giving any supplement to your horse. Now let's take a look at another type of colic, namely impaction.
Impaction colic happens when feed, sand or other material builds up and blocks part of the intestine. This blocks the flow of food and gas, causing pressure and pain. The most common causes include not drinking enough water, especially in cold weather or when eating dry forage. Coarse, fibrous forage like straw used as main roughage. Dental issues. Poor chewing may lead to larger feed particles that get stuck. Lack of movement, especially in horses on stall rest. Ingesting sand, often from feeding directly off sandy ground. The blockage leads to pressure and reduced motility. Gas becomes trapped behind it, which stretches the intestinal wall and causes pain. So how can you recognize impaction colic in your horse? Typical symptoms include the horse may pass little or no poop, which suggests that the gut has slowed down or even stopped moving altogether. You might notice a reduced appetite or see the horse chewing more slowly. The horse may lie down, get back up again, and repeat this behavior several times throughout the day. Some horses show subtle signs of belly pain, like occasionally glancing at their flank or pawing gently at the ground. When you listen closely to their gut, the sound may be unusually quiet or sometimes even completely absent. The horse temperature is usually normal and heart rate may be slightly elevated. On rectal exam, the vet may feel firm or distended loops of intestines or an actual mass of the compacted feed. Treatment focuses on pain relief, laxatives like mineral oil, rehydration, rest and frequent gentle walking, surgery in severe or non-responsive cases.
Now we have covered Impaction Colic. Let's move to another subtype of Impaction Colic, namely Sand Colic. Sand Colic has its own specific cause and risks.
Sand colic is caused by accumulation of sand, dirt, grit in horses' large intestine. This usually happens when horses eat hay, grain or grass directly off sandy or dry soil. Over time, this grit builds up in the large colon, particularly the right dorsal colon, and creates a heavy, abrasive layer. This not only causes irritation and reduced motility, but can also lead to impaction or even ulceration of the colon wall. So how can you recognize sand colic in your horse? Early symptoms may be subtle: mild belly pain, loss of appetite, diarrhea or loose sandy poop, repeated lying down and getting back up. Sometimes you can even hear the scent if you press a stethoscope to the lower flank, a sound like waves or grinding. On rectal exam, the vet may feel heavy content in the large colon or gritty resistance when performing a fecal exam. One simple and useful way to check for scent accumulation is a manure in a glass test. Take at least 5 freshly produced manure balls and place them in a clear bucket, translucent plastic bag or glove or glass jar. Add water, stir and let it settle. If your horse has been ingesting sand, you may see a layer of grit collection at the bottom within 15 to 30 minutes. But what's too much? A few grains of sand isn't usually a concern, but a full teaspoon or more per 5 manure balls is a clear warning sign. When in doubt, consult your vet. Treatment for sand colic includes pain relief, pure psyllium husks to bind the sand and help carry it out. They enjoy their sandy track system.
But remember to be careful with sand ingestion. We will talk later about prevention of colic. But first, let's take a look at a more severe type of colic, namely displacement.
Some colics aren't about what's inside the intestine, but about where the intestines have moved. Displacement happens when part of the intestine shifts to an abnormal position inside the belly. This can be because gas buildup or fermentation causes intestines to inflate and float, lack of gut motility, sudden movement, rolling or even stress can cause the intestine to move away from its original position. Sometimes the gut still gets blood flow, but food can't pass through. The symptoms of displacement colic can be quite distinct. Horses often show severe and ongoing discomfort, the kind that doesn't seem to come and go, like with gas and spasmodic colic. The belly may appear bloated, and you might notice that the horse hasn't pooped in a while. Their heart rate is usually elevated. If you listen closely, you'll hear a little or no gut sounds at all. Vets often describe the gut sounds as dull or completely absent, and during the rectal exam, things can feel slightly off, cause the intestines are no longer where they're supposed to be. To confirm their suspicion, they might use ultrasound or check for nasogastric reflux. Both can help indicate if a displacement has occurred. Mild displacements might be corrected medically, with fluids, walking and careful monitoring. But your horse may require surgery to reposition the intestines and remove trapped gas. Time is of critical essence. If the gut stays trapped too long, it can lose blood flow, and that brings us to our last and final type.
Once again, we understand the importance of recognizing symptoms early, because for some type of colics, early recognition matters. For the last type of colic, strangulation obstruction, it's even more critical to recognize symptoms early.
Strangulation obstruction is one of the most dangerous types of colic. It means that a part of the intestine has not only shifted, but is also being strangled, cutting off blood supply and blocking movement. This causes intense pain, tissue damage, and rapidly becomes life-threatening. This is a true emergency. Let's take a look at the causes. There are several ways this can happen, such as volvulus, where a part of the bowel twists on itself. This cuts off movement and blood flow. In this drawing, you see the large intestine twisting, causing strangulation. When blood flow is reduced, the intestine changes color and becomes dark. If not treated in time, this part of the intestine will die. A lipoma is a fatty tumor that wraps around the gut like a string and strangles the part it wraps around. As with any type of strangulation colic, the section that loses blood supply will change color due to lack of oxygen. Older horses and horses that are overweight are more at risk. An intussusception, where the intestine slides into itself like a telescope, causing a blockage. This usually happens in young horses. A hernia, where a piece of the intestine gets trapped through a tear in the abdominal wall. If manure gets stuck in the hernia, it can lead to a serious infection and even death if not treated in time. This often occurs in foals or yearlings. In this picture, you see an example of an umbilical hernia. They all cause strangulation, blocking of the blood flow. The affected tissue quickly becomes damaged, releases toxins, and can die within hours. This type of colic always requires surgery. The symptoms are intense and come on fast. The horse suffers of severe and unrelenting pain. Horse may throw itself down violently. Rapid breathing, high heart rate, dark or brick red gums, no gut sounds. The vet may find a very painful abdomen, dark reflux through stomach tube, and shock signs. There is only one option: immediate surgery.
Even with prompt care, not all horses survive this type of colic. But if caught early and operated on quickly, some make a full recovery. It's one of the reasons why it's important to know the signs and acting fast. So much starts with understanding how the horse is built and how it evolved over time, and what his body truly needs to stay healthy. Although we can prevent every case, we may lower the risk with some horse-friendly practices. By providing a lot of movement, continuous forage, and routine, that will help their gut to stay in balance, and their whole body too.
Horses are built to move. Their entire gut depends on motion. In nature, they walk 10 to 20 kilometers a day. This constant movement is vital for gut movement. Their intestines hang loosely in the abdominal cavity. Unlike humans, who can rely on gravity and abdominal muscles, horses depend mainly on movement to keep food and gas flowing. Each step helps activate peristalsis, the natural contraction that moves content through the gut. Lack of movement slows down this process, increasing the risk of colic, gas buildup, and impaction. That's why free movement isn't a luxury. It is essential for a healthy digestive system. A calm mind supports a calm gut. Stress affects gut movement and can trigger colic or ulcers. Horses are herd animals that thrive on social contact, clear routines, and a peaceful setting. Predictability brings peace, both mentally and physically. A horse's stomach produces acid 24/7, even when they're not eating. Unlike humans, horses can't turn off acid production between meals. In nature, they graze almost constantly, which means there's always something in the stomach to buffer that acid. If the stomach is left empty for too long, the acid can irritate and even damage the stomach lining, increasing the risk of ulcers. Sudden feed changes can disrupt the gut's balance. The microbes that help digest fiber need time to adjust. Always make changes gradually over several days. Eating hay or other food directly from sandy ground leads to slow sand buildup in the gut, a silent risk for colic. Use hay nets and mats to keep hay clean. Serve beet pulp or other feeds in a flexible bucket to avoid sand contamination. In sandy environments, offer psyllium on regular basis. It helps bind and remove sand. Choose products with at least 20% psyllium. Poor chewing means larger feed particles reach the gut, increasing the risk of impaction. Also, parasites can damage the gut lining or block intestines. Regular dental care and targeted deworming help keep the digestive system healthy and reduce the risk of colic. Cold snaps and sudden weather swings can trigger colic, especially in horses that drink less. Dehydration and slower gut movement are common in colder weather. Soaked feeds like beet pulp can help. They provide both fiber and extra water to support hydration and digestion. Lipoma that may cause strangulation of the intestine are more common in older and/or obese horses. Keep them lean and moving. You can't prevent everything, but you can meet your horse's basic needs as best as you can.
Planning for the unthinkable. Colic surgery isn't a light decision. It is hard, emotionally, but also financially.
The costs are high, and even if the surgery doesn't succeed, the full amount still has to be paid. That's why it helps to think ahead. Would you go through with surgery if the vet gave a 50% chance of success? Or would your answer change if your horse was older or already dealing with other issues? Every horse is different, and so is every owner. There's no right choice here, only what's right for you and your horse, for your own situation. What matters most is that you don't have to make this decision in panic or under pressure. Having thought about it in advance gives you clarity and peace.
We now had a clear overview of what colic is and what to watch for, and how to reduce the risk as much as possible. But even with the best care, colic can still happen. I hope this video brought you some clarity and you will recognize symptoms early so you can act in time. Don't forget to like and subscribe if you want to see more health-related videos. Thank you! Bye bye!